Welcome to Summarize Science. Today we're looking at a fascinating new way to detect a serious heart condition using just a simple breathing test. Right heart failure, or RHF, is a dangerous disease where the right side of the heart can't pump blood effectively to the lungs. It's often linked to lung diseases, and catching it early is critical for a patient's prognosis, but routine screening isn't always done. To tackle this, researchers developed an artificial intelligence model that analyzes data from spirometry tests, the common breathing tests people with lung conditions already take. The AI system works in two main stages, as shown in this diagram. First, it teaches itself to understand the complex patterns in a breathing graph, known as a spirogram. It does this by studying thousands of examples, learning the subtle features without being told who is sick and who is healthy. In the second stage, the AI takes the unique breathing pattern it has identified and combines it with basic patient info, like age and sex. Using all this information, it makes a prediction on whether the person is at high risk for right heart failure. The researchers used a massive dataset from the UK Biobank, including information from over 26,000 people to train and test their model. So, how well did it perform? The results were very promising, with the model showing a strong ability to distinguish between patients with and without the condition. What's even more impressive is how it performed on specific high-risk groups. For patients with chronic kidney disease, CKD, or valvular heart disease, VHD, the AI's accuracy was significantly higher, as you can see from the top lines in this chart. This is incredibly important, as these patients are already at an elevated clinical risk. The AI's analysis also confirmed what doctors already know from clinical experience. It found that factors like being older and male were strong predictors of risk, showing that it was learning medically relevant patterns from the data. The researchers proved that every piece of their system was vital. As this graph shows, when they removed parts of the model, like the self-training signal augmentation or the patient's demographic data, its performance dropped. So, let's recap the important points. A new AI model can analyze data from a common lung function test to screen for right heart failure. It combines the spirogram's pattern with demographic data to make an accurate risk prediction, and it works especially well for patients who are already at high risk. So, what could this mean for the future of medicine? This technology could turn a routine breathing test into a powerful, two-for-one screening tool for both lung and heart health. It represents a major step toward non-invasive, early detection that could help doctors intervene sooner and ultimately save lives. Thanks for joining us on Summarize Science.